Dr. Sajid here again. We're talking about vitamins, and today we will discuss vitamin C. It is an important vitamin. We'll discuss why it is important. We'll also discuss the possible sources of vitamin C, what happens if a child or a grown-up is deficient in vitamin C, and how do you recognize it, and of course how do you treat it, and can this be prevented. So vitamin C is also one of those vitamins that are essential for growth of the human body, and it is fortunately present in abundant quantities in our diet if we choose to take it. So the most important sources are, for example, oranges, which are obviously very readily available in our country. Also guava, strawberries, tomatoes, potatoes, also present in cauliflower and broccoli, also in lychee, and also in papaya, and in some vegetables such as cabbage and spinach. So the sources are available. One just has to ensure that the child is taking adequate and varied diet. So the difference between this and some other vitamins is that this is not really stored in the body, and therefore you require almost a daily dose of it. In other words, you have to take it practically every day. Now, what happens if the vitamin C is lowered? Then there are a number of functions of the body in which it is important. Number one is immunity, which means your well-being, and second is that it has an effect on the skin. That is, it can be the skin become somewhat rough and sometimes bumpy, and the hair growth may be poor, the hair may be kinky or weak, and also the child may feel weakness, fatigue, sometimes pain in the joints, and may have loss of appetite, and if the deficiency is greater, may also be depressed somewhat and have effect on the bone, and may also be anemic. If the deficiency is greater, then the gingiva can be affected, and sometimes, of course, in very rare cases, there may be bleeding from the gums or from the nose, and the child may bruise very easily. So there are some situations where the requirement of vitamin C increases, such as children with diarrhea, especially if it is prolonged, children with iron deficiency, and those who are malnourished, and in older people, of course, smoking causes deficiency of vitamin C. So there are some myths about vitamin C which I might want to discuss right here. It is not true that taking very large doses of vitamin C will prevent you from getting colds, and it is also not true that taking large doses of vitamin C will ensure that you don't get the COVID disease. So nevertheless, it is an important vitamin, one that you require to take every day, both children and adults, readily available, not expensive, and you treat the deficiency with vitamin C either in the form of drops or liquids, or of course tablets, and this is simple enough. But lastly, I will tell you one more time, and I usually end most of my talks like this, and that is that it is always better to prevent it rather than to worry about treatment, and this way you will have a healthy child.